So good morning and welcome. My name's Rebecca Cunningham. I'm an emergency physician and a substance use researcher, and I direct the University of Michigan Injury Center today. Our Injury Center is a multidisciplinary center. We have a broad focus on injury prevention, including violence and concussion, and certainly prescription drug overdose. And we are excited to have you here today. For those of you who don't know much about our center or are interested in more information, I encourage you to look at the website on the back of your program today and join for membership and information and updates on a wide variety of these topics. We're really excited for the day today. The summit came about in response to what we see as an urgent need for education and action to combat the emerging public health crisis. As an emergency physician, I've seen the pendulum swing over the last 20 years from very conservative pain management practices to pain as the fifth vital sign. And as a substance use researcher, we have measured the concurrent epidemic that we're seeing today. So we've set aside today to focus on the state of the science and what health systems and communities are doing to work to address this problem. And we're really glad that you're here to participate in the conversation. I'd like to take a moment to thank some of the groups for their generous support and acknowledge the people who helped today make this event happen. Our partners for today's event, without which it would not be possible, are the Institute for Healthcare Policy and Innovation, the University of Michigan Department of Psychiatry, a special thanks to the chair, Dr. Dalek, the University of Michigan Substance Abuse Research Center, and Don Vereen for their support, the medical school, the Michigan Institute for Clinical and Health Care Research and Policy. We're also very fortunate to have strong partners who share our mission for preventing opioid overdose. I'd like to acknowledge a few other people that are here today and ask them to stand for a moment. Dr. Karen Mack is a senior behavioral scientist at the CDC, and we're grateful to the CDC for its support of our infrastructure funding. Without this event would not be possible. Also, Patricia Anderson, just a little wave there, is an emerging technologies librarian from the medical school library. She will be live tweeting our event today to her 11,000 followers. She will also put together a Storify social media summary of the event today, and we'll send out a link. Please look for that later. Most of all, we're really excited that you are here today because we are really excited about the quality of the presentations and the speakers that you're here and the many conversations and networking that will happen. And hopefully together, these will make an impact. This includes those of you that are tuned in on the webcast. We're so pleased that you'll be able to be a part of the event. We have people joining us from the Ukraine, as well as from all over, including just down the street. And we're glad for everybody to be able to participate. A few logistics. We're excited to be able to offer CME credits today for nurses and physicians. Please look at an email later for information on how to claim those credits. For social workers, we're excited at the last minute we were able to obtain through social work engagement. CEUs have been approved. Please see Tags Monachek or Sarah Kusin. Sarah Kusin, can you stand? There you go. Thank you. If you would like to get your CEU credits, see them during the break to sign in. If you need anything while you're here or have any questions, please talk to any of the Injury Center staff that are wearing yellow badges. We thank them all for their hard work to organize the logistics of this event today. We have a full day of fascinating speakers. We'll make every attempt to keep everything running on time. We also ask you to help us by moving back quickly after breaks.